and your rights. Plus, life in lockdown for one zoo, how alpacas are helping with social distancing. It's not too late for you to get in touch. You can call us. The number is on your screen now, 0333 015 1128. Just leave your question on a message or get in contact by email on Twitter, Instagram or Facebook. First tonight, here's what you need to know this week, the start of our 6th in lockdown. There have been almost 3 million cases of COVID-19 globally. More than 200,000 people have died. Nearly 900,000 have now recovered. Here, the Prime Minister has warned against lifting the UK's lockdown too quickly on his first day back at work.
I refuse to throw away all the effort and the sacrifice of the British people and to risk a second major outbreak and huge loss of life.
And in the UK and around the world, the first trials have begun on humans to try to find a vaccine. My guest tonight is from the World Health Organization. Its aim is to direct international health responses, especially at a time like this. Earlier, I put your questions to Tarik Jašarević. Tarik Jašarević, our first question comes from Roma, who wants to know, can the virus weaken and diminish on its own, or is a vaccine the only way it can be eradicated?
Well, this is a new virus, so we are still learning about it. We still don't know how this virus is going to behave in a different conditions. What we have seen is that so far it's a very stable virus. We haven't seen any genetic modifications so far. We have to really work on different fronts. So definitely one front is vaccine. We are working with a number of researchers around the world, and there are more than 70 vaccines that have been being developed already, and some of them are already in the first phase of trial, but it will take some time to get the vaccine. We are in a parallel working on therapeutics. There are trials ongoing in different countries. But for the time being, really what we need to do is basic public health measures in terms of isolating people who are sick, caring for them, making sure that their contacts are also being monitored. So try really to isolate the virus from the population.
OK, David in Aberdeenshire has a question on testing. He wants to know, would we not be best to test everyone before we lift any restrictions?
Well, the World Health Organization has issued a guidance to countries who wish, who plan to ease the measures that have been put in place. We would really like everyone to be able, first of all, to strengthen the health capacities. In the case we see an increased number of patients as a result of reduction in this physical distancing, so health systems can do that. We also want countries to be able to quickly test and isolate. Now, when it comes to testing, what we really want to make sure that all those who are suspect to have contracted COVID-19 have access to testing, so we know who is actually sick, who is infected, because these people are primarily source of infecting other people. So testing should be available for all those who are suspected of being infected with COVID-19.
Tarik, is there an antibody test that works yet? Have you found one?
There are a number of antibody tests that are out there, but we currently do not recommend use of these tests until they are independently evaluated. We have issued yesterday a document, scientific brief, where we clearly say that we think that it is likely that antibodies will confer some immunity, but currently we have no evidence on how strong this immunity is, how long it will last. So for the time being, the tests that we are using and we are recommending are those that determine if people has the virus at this point in time. Having antibody tests, or what we call serological tests, will be very helpful once we have them to determine how many people have actually been sick in the past, because serologic tests are looking into antibodies that have been developed by by the sick person, and that indicates that someone has been sick. This will be very important. Right now, despite the number of tests, they have not been independently evaluated, and there is a risk really of false positive and false negatives, then bring all sorts of other issues.
A question that's come into us on Twitter: how will the WHO seek to regain the trust of nations such as the USA?
Well, we are continuing to work with all countries around the world. On Friday, we launched the initiative on vaccines in order to make sure that the work on vaccines and other tools for COVID-19 is being coordinated. And we have seen world leaders coming to work on this, because what is important, not only to work on development of these tools, including vaccines, but also to make sure once we have them, the access and distribution is equitable and it can go to everyone in the world. US and other countries are all partners with WHO. We work with everyone because our mandate is really to look into science, look into evidence, and propose the best possible rationale to all countries when they plan their public health interventions.
Do you think you could have done more in terms of leading a global response to it, though?
Well, WHO has been leading the global response from the day one. I will just remind you that on January 5th, we have issued a first communication to all countries around the world on what was that pneumonia of unknown origin, that already on January 10th, we have issued first set of guidance, and we have trying really to keep these guidance updated as we were moving forward and as we were getting to know more about a virus. WHO has declared COVID-19 as a public health emergency of international concern on January 30th, and that's the highest level of alert that we have under international health regulations. International health regulations is a document that has been agreed by all member states.
Okay, Elaine wants to know, what is the truth of how, where and when this coronavirus started?
Well, we have received the first communication from Wuhan health authorities on 31st December 2019, where there was a report of a number of cases of pneumonia of unknown origin. So this was during the seasonal flu season, and that authorities over there and health workers have noticed the pattern of increased numbers of pneumonia, and that it was the first time it was suspected that there is a respiratory syndrome. And then on January 9th and January 12th, the genetic sequencing has been done and shared with the world.
But where specifically in Wuhan, we've had lots of questions asking whether, for example, wet markets should be banned.
Well, first, all the evidence we have so far point that this is the part of corona. This is the coronavirus that was circulating in the animal world, and that, as other coronaviruses in the past have sort of jumped from the animal world to the human population, as it was a case with SARS and MERS, for example, other coronaviruses. We still don't know what is the exact source in that animal world of this virus, and research is ongoing right now.
Tarik Jašarević, thank you very much for joining me. Thank you.
Thank you.
As you might imagine, we're still getting lots of different questions about your health right now. Let's go through some of them with Dr. Sarah Jarvis. Hello to you. Can I just start by asking you for your take on news of an urgent alert sent to GPs about a possible COVID-related syndrome in children? Can you reassure parents who are hearing about this tonight?
Overall, yes, I can. It's always a concern if you're a parent. Of course, you want the best for your child. And overall, what we've been saying until now is the likelihood is that children will get much milder disease, and much more likely to have mild disease, and indeed may have no symptoms at all compared to adults, particularly compared to older people and people with underlying medical conditions. We've seen a few cases. It is a small number of cases of children becoming very unwell, and particularly things for parents to look out for are severe abdominal pain, tummy pain, diarrhea, vomiting, and so-called heart symptoms. Now, what we're thinking about there is, for instance, being very short of breath, because heart problems can make you short of breath, gasping for breath, but also looking very blue around the lips, skin that looks pale or mottled, being abnormally cold to touch. But really the message is children are not much more likely today than they were yesterday to get seriously unwell. But if you have a child who is really poorly, please do not put off seeking help. Same thing applies to adults. We're seeing huge numbers of people not accessing emergency help, and they are putting themselves at much higher risk by not getting help than they would be if they went into hospital.
Okay, yeah, Sarah, really clear message there. Let's take a question now from Sana.
After Chris Whitty's announcement the other day that the UK is likely to be in some form of lockdown until the end of the year, does that mean that those of us who are in shielding currently will now be shielded indefinitely?
Dr. Jarvis, will they?
So the shielded group are the ones who are most vulnerable. They're the people who are most likely to become seriously unwell. So shielding is being recommended for your sake. However, as the number of cases drops, the risk will get smaller and we may be able to loosen those restrictions slightly, but it will be probably later for people who are shielded than for others. But one thought is that, for instance, when we get this antibody test that we've just been hearing about, which we do think we'll get within, I hope, a few weeks, we may well be able to say that if you've got people who've been proven to have had the coronavirus, who are therefore immune to it, you may well be able to communicate with and socialise with them.
Keeping everything crossed. Many of the shielded will be grandparents. Roy wants to know, will we be able to cuddle our grandchildren again? You may have just answered that.
Golly, that's a tough one. Of course, not all grandparents are in the shielded population, but most of them are more mature, shall we say, and that does mean that they're at higher risk. Now, I'm not saying you're going to be able to cuddle them, but I think as restrictions ease, we should certainly see, for instance, close family groups being allowed to get together, hopefully in the fairly near future, but certainly with social distancing. So while you may not be able to cuddle them, you certainly should be able to watch them playing on the lawn in front of you, maybe do things with them. You'll certainly not be relying just on social media, video calls and FaceTime calls and whatever telephone calls to keep in touch.
A couple of questions about recovering from COVID now. The first from Ravin.
I have recovered from coronavirus at home, but 3 weeks on, I have other symptoms. I'm feeling thoroughly exhausted throughout the day, having to rest a lot. I have aching limbs, and I'm breaking out in night sweats and day sweats. They just come from nowhere, and I shiver, and I can't warm myself up. I'm just wondering if this is normal post-infection, and if so, how long can I expect these symptoms to last?
Poor man, what's your answer for him?
It is very, very common to feel profoundly tired. We're hearing a lot of people talking about that, and to hear people who are talking about having aching limbs or aching muscles. The night sweats more go perhaps with the fact that your fever is still coming and going, and that might suggest that you're still infectious. But the tiredness, we think, may well last for some considerable time. How long will it last? It's really how long is a piece of string. It's very variable, but certainly the tiredness is more likely to last than the muscle aches and the sweats.
Okay, finally a question from 13-year-old Simil.
My question is, why has the UK not published data for how many people have recovered from COVID-19? Because if they did, it would give some glimmer of hope to people, as we only hear the negative figures.
Briefly, Sarah, can you answer this one?
I can, and the answer is that on the whole in the UK, of course, until recently, only people who've been very severely unwell with coronavirus, who've needed hospital admission, have been recorded. So the figures for them are going to be much, much lower, and ironically, they would probably be unrepresentatively negative. So we've got a lot of people out there who've had mild symptoms and who have recovered. Because we haven't been testing as much as other countries for a whole host of reasons, that means that our recovered figures would look very poor in the same way that our death rate looks poor, because we're not testing the people who've got mild symptoms.
Dr. Sarah Jarvis, thank you very much. Thank you. I'm going to take a short break now, but when we come back, our consumer editor Chris Choi on everything from online shopping to metal detecting. We find out why flights are still coming in and out of the country, and
We've managed to bring some of the animals out of their enclosures and actually take them for walks around the zoo.
What life is like in our zoos with no guests to keep the animals entertained. Welcome back to Coronavirus Q&A. We've been inundated with some questions about the same issues. So tonight we're going to look close up at one of your concerns, airports. Some of the most frequently asked questions are about airport arrivals. Many of you want to know why planes are still landing and why health checks are not being carried out at the borders. The number of flights landing in the UK has declined dramatically during this crisis. Heathrow, Europe's busiest airport, expects passenger numbers for April to be 90% lower than last year. Most passengers flying in and out of the UK are on repatriation flights. Other countries have implemented temperature checks, but the World Health Organization and the government say they are ineffective because of the incubation period and the rate of infection here. New arrivals are being told to stay at home like the rest of the population, but in future could be told to quarantine for 14 days. Airports have introduced social distancing. There are announcements and leaflets for passengers, and sick travellers are reported to officials. In the future, airports say they would like a global standard for airport testing, like there is for security screening, so passengers know what to expect. And the problems and conundrums continue for our everyday lives. Time to get the latest advice from Chris Choi. Look, this issue of online shopping hasn't gone away this week. Julie says her mother-in-law lives on her own in Yorkshire and is 85. She is struggling to get online shopping. Julie asks, how can we make her a priority? She's also, her mother-in-law, hard of hearing, so she can't talk to people on the phone.
Well, thanks, Julie, for bringing us right to the heart of an ongoing problem in this crisis. The supermarkets are using a list they got from government, which is meant to show the extremely vulnerable, but it doesn't include a lot of disabled, frail, elderly people. On the other hand, the supermarkets in parallel are using a lot of their own data from things like loyalty cards to try and prioritise home in on the elderly and vulnerable. But people like Julie's mother-in-law may not be in that data either. A lot of people are falling between the cracks. Now, there's something new on this, in that the supermarkets are about to put links on their own websites to voluntary groups that can help with the shopping. In the meantime, if all else fails, go to your local authority. They should be able to arrange support. OK, contact your council. Right, a furloughed pub manager who didn't want to give us his name, he asks, I live on site. Can my company expect me to complete tasks while we remain closed? No. When you're on this furlough job retention scheme, you can't work for your employer. What they'll have to do is bring in an outside contractor or a member of staff that's not furloughed. OK, since we opened our phone line this week, we've had numerous questions about cars. Here's a couple. Firstly, John wants to know, how can he renew his driving licence? He's been having difficulty with that. Well, key workers can still do it using the post. Everybody else online, but it can take now more than 3 weeks, so plan ahead. OK. Secondly, someone asks, is it safe for the public if someone drives around in an open-top car? It's a lovely idea, isn't it? Especially at the moment, to get a bit of wind in your hair. A lot of people have more hair because the salons are closed. But yeah, you can drive for essential journeys, but if it's open top, you've got to make sure that you're 2 meters away from other road users, including pedestrians. If there's any doubt, I'm afraid the lid's got to come down. Yeah, that's a tricky one, isn't it? Someone, again, who didn't want to give us their name says, is it okay to have potential purchasers visit a private residence to buy homebred puppies at this time of lockdown? It is a lovely, cuddly question, but people like the Kennel Club are advising against that. It is possible to flip it. If it's a business that you're buying puppies from, and as part of that business they can deliver using social distancing and full hygiene, which can be quite difficult with puppies, then that can go ahead. OK, deliver of puppy is the way to go. And a question I imagine you never thought you'd ever be asked, but Shane wants to know, can I go metal detecting for exercise if I am alone? Not really. The National Council for Metal Detecting, yes, there is one. They cannot be messed with. They advise against it. They say quite rightly that it starts with one person going out, it then can become a group. It can escalate because if you actually find something valuable, the police have to be called in, sometimes archaeologists. The indoor version, maybe use your skills to try and find all the change that's gone behind the back of the sofa, something like that. Can't get into much trouble. Chris, thank you very much. We obviously can't answer all your questions, much as we'd like to, but Chris and Dr. Jarvis will be answering some more on our website in just a few minutes' time. Before that, whilst we're all on lockdown, we thought we'd take a look at some of the workers across the country who are still doing their day jobs. Let's take you to Colchester Zoo.
Hello, my name is Sarah Forsyth. I'm a curator here at Colchester Zoo. This is not my normal daily routine. It's very rare that any of the keepers will see me mucking out an enclosure, but because we've had to furlough so many of our staff and we're so short, this is now something that I'm getting stuck into. Hi! They never normally interact with me this much. I think they're just missing people so much. Every time I walk past the enclosure, they come running over to say hi. What you doing? Because we're so quiet and all our pathways and all of our walkways are empty, we've managed to bring some of the animals out of their enclosures and actually take them for walks around the zoo, which has been great because it gives them quite a lot of stimulation and also actually keeps spirits up for the keepers as well. So one of the ways of being able to maintain social distancing in accurate 2 metres is to have a llama or a alpaca between you and another member of staff. We've had some amazing births, the animals are growing, the babies are doing well, and we just can't wait for people to come back so that we can start educating them again about how amazing these animals are, and also knowing that we've got a secure future and we're going to be okay.
Oh, loving those penguins. Thank you, Sarah. We're online next or back here next Monday at 8. Thank you for your questions. Thank you for watching. Good evening. Coronavirus Q&A online. I'm joined by Chris Choi and Dr. Sarah Jarvis. I'll start with you, Chris. We've had a question in from Kay. She writes, my sister and I, both elderly, live 80 miles apart. We have both been behind closed doors since the beginning. Can I go and stay with her for the duration?
Well, you can quite understand why two sisters would want to be together at this very, very difficult time. And you kind of want the answer to that question to be yes, but it's much more hazy than that. The underlying principles to these guidelines are to try and stop people mixing between households. And what the authorities say is that that's particularly important if you're in a vulnerable group, as these ladies are. When we talk to Public Health England about this in the past, generally they discourage this kind of thing. They say that this kind of mixing shouldn't be going on. They encourage people instead to support one another using electronic connections, phone links. They don't actually give an exception within the guidelines for this kind of movement.
Let's bring Sarah in on this. No exceptions. It just seems really unfair, doesn't it?
It does indeed, and I have to say I never thought there would come a day when I disagree with Chris Choi about anything at all. But I'm going to disagree with him now, although I'm not really disagreeing with him, I'm disagreeing with the guidelines. So I think what we need to realise is we need to be pragmatic. We've got two people here who presumably are living alone. They may therefore be very socially isolated, and we've got to think about their mental health. I think the question people have to ask themselves is, can I completely safely, putting not myself and not anybody else at risk, work around these guidelines? And in this case, we've got two people, both of whom have completely socially isolated for 2 weeks. And if you've socially isolated for at least 2 weeks, then you are essentially not at risk, because at least 97.5% of people will have developed symptoms. They're going to get them by then. So from my perspective, as long as they don't have to travel a long distance to get to each other, as long as they don't have to put themselves at risk en route from one to the other, and as long as neither of them is shielding, or certainly not if they're both shielding, then I think it would be reasonable for them to just make a single trip, hope not a long trip, but if it's a reasonable length trip, to make one trip to be together and then to hunker down together.
OK, Sarah, thank you for that. A question now from Hayley about who is getting COVID.
Hi. So my question is, does your blood type make you more susceptible to getting the coronavirus?
Sarah, does it?
So there was a lot of concern about this when it came out, because a study came out suggesting that people with blood group A were more likely to get coronavirus. Now, when you drill down to the figures, actually the difference isn't that enormous. About 31% of the population have got blood group A, including me, I might add, so I had a vested interest here, and about 38% of people who got coronavirus had it. We do know that your blood group can influence your immune system, but it's probably not a big risk, and that's even if it does exist. And there may be lots of other so-called confounding factors that mean that this isn't, in fact, a real link.
Can I just ask you, Sarah, how long will it take? So we're learning lots about who is getting it, who's falling seriously ill, who's dying from it. Are we talking a year from now, 5 years, 10 years from now, when we've got this body of data from around the world to be able to say, if you're male, you are more likely to suffer badly, if you are obese, if you are from an ethnic minority? How long does that kind of research take?
We're probably talking years. We are growing that body of data faster than anything I've ever seen before. In 33 years as a doctor, I've never seen so many articles as about one subject as I'm seeing about coronavirus. Normally, we would say decades and we still don't know anything. In this case, we may be saying within a couple of years we'll have a lot of the answers.
Okay, we've had lots of questions from our viewers about vitamin B12. Julia wants to know, why have most GPs put a halt to vitamin B12 injections during this pandemic, even though the World Health Organization considers it an essential treatment?
So if you have pernicious anemia, then you can't absorb vitamin B12 properly. And that means that you do need regular injections, and they are indeed absolutely essential. The difference is, I think, semantics. It's how often you need to have them. In the UK, once you've had your levels topped up with a loading dose, you get usually an injection every 3 months. And 3.5 months is not going to make a lot of difference compared to 3 months. Having said that, some people believe that their symptoms, particularly numbness, tingling, pins and needles, burning in the legs and feet, can come back before that. So if you are getting those symptoms, I suggest you contact your GP, explain that your symptoms are coming back, and they should be able to arrange an injection for you. They're not stopping them, they're just delaying them slightly.
Okay, a question now from Kelly on the accuracy of COVID tests.
I've heard from people who work in hospitals that the test for coronavirus is only accurate about 70% of the time. Is this correct? And if so, how many people who tested negative have since passed away and are not included in the death toll?
Sarah, is that true?
So they're talking about the PCR test, which is the Have I Got It test. And that test isn't always accurate. It's not very often accurate if you don't have symptoms. And we are seeing people who get what are called false negative tests. They've got it, but it doesn't show up as positive if the swab isn't taken correctly or later on in the disease. Having said that, it's highly unlikely that people would die from this condition with a negative or without having a diagnosis made, because there are also changes on the X-ray, which would tend to show up.
Okay, that's reassuring. Linda wants more information about how the virus can be passed on, presumably in workplaces. Let's have a listen to her question.
Is it possible for the coronavirus to be transmitted by means of air conditioning, either by going into the air conditioning unit and being blown out, or by someone coughing or sneezing and being carried through the air caused by the draft from the air conditioning?
Aircon.
So there was a case in Asia where a restaurant was closed. I think it was in South Korea, after several different groups of people contracted coronavirus, and it was thought they contracted it through the air conditioning. But the risk is small, very small compared to being within 6 feet of somebody else. So the biggest risk we know is, number one, somebody coughing or sneezing straight at you. Number two, that virus, because it's quite heavy, landing on the ground and then that being picked up, so-called fomites. That's a contaminated surface. However, we know that sometimes the virus can be spread in smaller aerosol droplets. Those might be picked up in the air conditioning, but the risk is small.
Okay, for now, Sarah, thank you. Let's bring Chris in. a range of questions for you. You've had to become an expert on so many different areas. Let's start with another about cars. Jason says he's got a company car, but he's working from home. I can't imagine he's alone right now. He asks, can I stop paying BIK tax, benefit in kind tax, as the car is technically unavailable?
Oh, thank you, Jason. Very tricky question, taking us into the outer reaches of accountancy now. It's intricate, but there is an answer. Normally, to escape that particular tax, you have to give the car back physically for at least 30 days, and that gets you out of having to pay. HMRC have conceded that in current difficult circumstances, it may not be possible to give the car back. So they say, if you just hand the keys back, or the fob, if it's an electronic entry system, hand that back. They say you can do that through the post as well. It's not good enough, for example, just to take a photograph of your mileometer and say, look, I haven't used the vehicle. That's not the issue. The issue, it has to be unavailable for use, so you can't have access to it. So in the old days, you had to get rid of the car. Nowadays, just get rid of the keys.
Okay, post your keys back.
That's it.
On flights, John says he's booked a holiday for the 9th of May, coming up with Love Holidays. They have paid Ryanair for the flight. If Ryanair doesn't cancel our flight, do we have to go? Also, he wants to know, do we have to accept a voucher? Just to add to this, there was 11 of them going, and it was their first family holiday.
Oh, wow. It's a big holiday and a big bill with 11 people involved. And I'm so pleased that John has asked this one, because it is still a problem for so many people and not always getting the right answers from the travel providers. I think the first thing to do for this family is check, has this flight been cancelled? Because in a way, I'd be surprised if it hasn't. Ryanair certainly is one of the airlines that has grounded most of its fleet, and they have said they're not expecting to get much moving before June. So it's likely that this flight has already been cancelled or will be very shortly. When it's cancelled, you're entitled to a refund. There's a lot of talk about vouchers, particularly if you look at Ryanair's website and other airlines doing the same. It is easier for them to get you to accept a voucher, but you do not have to accept a voucher. You are entitled to money back. That is your entitlement, but you may have to persevere. They're making it relatively easy to get the voucher. To get your money back, they're saying you may have to wait. And, you know, fair is fair. They are absolutely overwhelmed with refund requests, and many of their staff who are processing all of this are working from home, some of them off sick, so they have got a big problem. As a backup plan, of course, it sounds like this is a package holiday and they're covered under what's known as the ATOL scheme. That should pay a refund within 14 days. There's another sneaky problem here as well, in that the industry is saying they can't give the refunds to the normal schedule. They've asked government for longer, and we're expecting an announcement on that very thing sometime this week.
Which did a big report on this, didn't they, that last week? So the clear advice is, if you are being offered a voucher for a flight or a holiday, just persevere, just believe you will get the cash refund, just persevere.
I mean, there are some people who may be happy to accept a voucher, buying this message that it will, in a way, help the travel industry that is being overwhelmed. Other people might be happy to rebook another date, and a lot of the airlines, including Ryanair, are making that possible without any charges. But if you want your money back, you don't have to take a voucher. I wish I had a loud hailer, I'd shout it out.
Bring it next week. Let's get back to Sarah. I've had a question in from John, Sarah, who says he is 89 and he wants to volunteer for clinical trials for a vaccine. He has contacted a few people about this. He wants your help now because he's getting nowhere. He wants to be in the over 80s group for obvious reasons. He really wants to help.
So it's a fantastic thing to want to do. We are at very early stages with the vaccine. We've just, of course, started the Oxford vaccine trial. The first stages will be done on healthy people, and they'll probably not be taking anybody over the age of 55. The next stage will be looking at the relative dosing, and it may well be that they'll start thinking about what dose they need to get a good response in people of different ages. But the bigger trials, which are likely to be coming in a few months' time, I think they may well be looking for older people. I'm just not quite sure they'll rise as far as 89, but they might.
Oh, John needs to try and help in another way, doesn't he? We've got a question from Mike and Chris, who are abroad right now.
Can mosquitoes transfer the virus to humans?
Mosquitoes.
So I'm not surprised they've asked because, of course, we do know, apart from malaria, which everybody knows about, they can also transfer yellow fever and, of course, the Zika virus. But no, there is no good evidence that mosquitoes can transfer coronavirus. It's passed on directly. It's a virus passed on from other humans to you rather than through this vector, the mosquito.
Okay, Dr. Sarah Jarvis and Chris Choi, thank you very much for answering all those questions so brilliantly as ever. We'll see you next week on Coronavirus Q&A online. Bye-bye.